first and foremost, folks, let's talk about what the enrollment deadlines are. So let's put that up. So when you're looking at the deadlines for Medicare and you're looking at the deadlines for the ACA marketplace enrollment, you're looking at the Medicare deadline that is December the 7th. So that is next week. You have less than a week if you want to change what's going on with your Medicare plan. When it comes to the ACA enrollment deadline, you can see on your screen here, the deadline is the 15th of December, and that's if you want your coverage to begin as of January 1st, 2023. All right, hey Steve, let's first talk about Medicare. And a lot of people are like, all right, well, I'm already enrolled in Medicare, so why do I need to be up with this whole enrollment period deadline?
Okay, so this is just a great time of year. Let's say you're already enrolled in Medicare and you have a Medicare policy that helps out with expenses. This is the time of year, maybe you don't like something about your plan. Maybe the drug coverage is not what you thought it would be. Maybe your copays are more than you wanted. So this is the time of year when you can jump out of one plan and hop into a new plan starting January 1st of next year. So it's just a wonderful time of year where you have opportunity to do that. Now, it's important to know that this is a time for people that are enrolled in Medicare Advantage plans. They can act now. And also, even people that's still covered under traditional Medicare, but maybe they have like a standalone drug plan, the standalone drug plans can also be changed right now. So you have until December 7th, which I'm thinking is like next Wednesday.
Yep.
So you need to really get to work on that if you've not done it yet. So.
Okay. All right. So, Laura, let's talk about the ACA healthcare marketplace. The deadline is a little bit farther out, but we still want people to be looking at things. A lot of people will kind of go online and they'll be like, you know what, healthcare is too complicated. I'm just going to leave it in the same plan that I had last year. What would you say to that?
Well, first of all, there's two deadlines. December 15th, if you want coverage starting beginning next year. The absolute last deadline is January 15th for the procrastinators that wait through the holidays, and then your coverage would start in February. But why you should go back, even if you're already enrolled, is first of all, your plan may have changed, or it may have gone away, and you may be auto-enrolled into a new plan, and that may not be the best plan for you. And second, your life circumstances may have changed. And also, with everything that's going on in Washington with the Inflation Reduction Act, plans are cheaper than ever for next year in that there are more subsidies for people. So you may not have qualified in the past, but it's definitely worth going back to healthcare.gov, plugging in your estimated income for next year, looking through all your options, and picking the best one for your circumstances.
All right, and here's the beauty of all of this. You can go there on the marketplace and you can look at all the plans, but if you're still having trouble, there are helps out there for you. AARP can help out, but you can also call a insurance agent and they will walk you through things, and they don't get paid for that, not by you. There's no fee for you. It is free for you to do that. All right, Pat, let's talk about Medicare enrollment. Now, this is open enrollment right now, but there are some folks who are going to be getting to that Medicare age, and they're kind of unsure about when they need to sign up for Medicare. So what's the timeline for that?
Well, that's right, Tanya. Folks turn 65 every day of the year, and so they're looking at the trying to understand what the enrollment process is. Keep in mind that the primary federal agency for enrolling folks in Medicare is the Social Security Administration. And so folks they can go to the Social Security Administration .gov and enroll themselves if they're comfortable doing that, or they can contact their local Social Security office in their county and make arrangements. They can have their questions answered about the enrollment process, or they can actually set an appointment to enroll. Now, Social Security, occasionally, there is something called automatic enrollment. Folks that are receiving Social Security benefits, for example, their retirement benefits early, they actually get enrolled automatically by the Social Security Administration. They'll actually get their Medicare card in the mail 3 months before they turn 65. But those folks, and there are a lot of them, probably the majority of the folks that are turning 65, they have what's called an initial enrollment period, which is defined. It starts with their month of birth, and it's 3 months before So the enrollment process would begin 3 months before your month of birth and then 3 months after. So it's a 7-month window altogether. And they would go through that process again using Social Security online or the local Social Security office. Now, if folks miss that initial enrollment period, there's something called the general enrollment period. It comes around every year, which is January 1 through March the 1st through March 31st. So there's that window is there for folks that fail to enroll when they could have during that initial 7-month period.
All right, so it is 7 months, 3 months before your birthday, your birth month, and then 3 months afterwards. Now, a lot of folks will say, well, I already have my employer's benefits, I'm still working, I don't need to sign up for Medicare when I'm 65 because I'm still working. What do you say to that, Steve?
Well, you probably need to still go ahead and sign up for your Medicare. Medicare Part A is free, so there's no cost for that. So it's always a good idea to go ahead and tag the Part A and go ahead and get it going. Now, if you do have employee benefits or group coverage through your employer, then obviously you can stay on that coverage and defer to Part B, which is usually the part that's going to cost you money, or they're going to withhold out of your Social Security check. So you can defer Part B, but go ahead and turn Part A on because it's free anyway, and that way you're in the system. And always remember, if you're doing that, if you're still working, once you do decide to retire and then you drop your group health coverage, you want to call Social Security again and get that Part B going right away because it's a short window there to get that going without having a penalty involved.
Yeah, that penalty for Part B is not something that you want because it happens for the rest of your life and you don't want to pay the extra cash.